Hello, I'm Station Manager Adam Barron at Lancashire Fire and Rescue Service, and I'm here at the former SupaSkips site in Lancaster alongside Richard Walsh, Public Health and Protection Manager from Lancaster City Council, and Mark McGivern, Consultant in Health Protection for Cumbria and Lancashire from the UK Health Security Agency. Our firefighting operations are continuing today in conjunction with the demolition work and removal of waste from the site behind me. The fire is deep-seated and involves over 13,000 tonnes of compacted waste, and this fire is going to take some considerable time and resources to extinguish. Over the weekend we have been trialling a new robot which has enabled us to get more water onto the fire, and we are continuing to do all we can to ensure this fire has a minimal impact on residents and businesses. For your own safety, please stay away from the incident ground, as there are lots of vehicles moving around the site taking part in the demolition and extinguishing of the fire. Finally, I'd like to say thanks to the public, partner agencies and demolition contractors for their support during this incident.
Hello, my name's Richard Walsh and I'm the Public Health and Protection Manager for Lancaster City Council. One of the main concerns that has been raised since this fire started here at the SupaSkips site over a week ago is how we are monitoring air quality and the effects of the smoke on local residents. Lancaster has a number of air quality monitoring sites in the city centre, and the data from these informed the initial air quality assessment immediately after the fire began. These are now being supplemented by additional air quality monitors nearer to the scene to provide more robust and localised data. We are also looking at installing additional monitors to support this work. These sites are being monitored by the City Council in conjunction with the multi-agency coordination group that has been established to manage the incident. The raw data from the monitors provides us with useful information, but by itself does not provide the full picture, and other factors also need to be taken into consideration, such as wind direction and wind speed. Taken together, this then provides us with the information needed to determine whether additional action needs to be taken over and above the current advice. This advice includes that if the plume is passing your home, then you should keep windows and doors closed, keep any respiratory medication to hand, avoid going outdoors, minimise physical exertion and contact medical services if you are feeling unwell. It is also important that when circumstances allow, such as when the plume is not affecting you, you should ventilate your property to replace contaminated air with fresher air. Should this advice need to change, based on the monitoring data and the other factors I've mentioned, contingency plans that have been developed to support residents will be communicated should they become necessary.
Hi, I'm Mark McGivern, a consultant in health protection for the UK Health Security Agency North West. I understand that people in Lancaster living close to the fire will be concerned about smoke from the plume. Our advice is, if you're exposed to smoke, you may experience symptoms such as coughing, a tight chest or a sore throat. These symptoms usually disappear very soon after the exposure has stopped and don't lead to any long-term health problems. The best way to minimise your exposure is to shelter as much as possible by limiting the amount of time you spend outside in the smoke. If you can see or smell smoke, stay indoors where you will be protected from the worst of the smoke, and keep your doors and windows closed. If you need to be outdoors, try to avoid outside areas affected by any smoke or ash and limit the time that you spend in them. If you can no longer see any smoke outside, consider ventilating your home with fresh air. Take the opportunity to open your windows and doors, but to remember to close them again if the smoke returns. If you're experiencing health effects that you think may be related to the smoke, please seek medical advice by calling NHS 111 or by contacting your GP. If you have any existing health conditions, discuss your concerns and symptoms with them. And in case of an emergency, call 999.